First of all, I would like to ask how many veterinarians are in the room? Okay, almost half. Perfect. Maybe I'm last but not least in presentation. I hope that veterinary role in the dog population management is very important. And also I'm going to try to raise up several questions, maybe some of them a little bit provocative, in order to be a good introduction of the final activities in the program, the final panel discussion. What I would like first to say, I would like to thank Dog Population Management Program in Bosnia and Herzegovina that give me opportunity to share my ideas about this problem. And also I got information that what Dog Trust actually, a program in Bosnia, what he did in the last 15 years, it's really astonished. A lot of improvement, especially from the veterinary perspective, a lot of improvement in the veterinary clinics, introduction of this protocol for the surgical procedure of dogs. I think so it's really, really amazing. But in my presentation, I would like to raise questions regarding the veterinary profession from other perspective. I have a feeling that in these 2 days, we saw veterinarians only as a part of activities relating with the sterilization and castration. I believe that our role as a veterinary profession in this dog population management program is really important from the perspective of the public health and One Health concepts. So the context of my presentation will be in that direction. Also, I would like to stress, because we are coming from the majority of participants from the Western Balkan countries, that many changes, many activities which we are designing regarding to dog population management are actually part of the activities of European Commission. We yesterday heard about the new drafting law concerning the welfare of dogs and cats. This is the first registration in the European Union of this issue, and it is very important to starting to think in our society how we are going to introduce this new provision in directive, and I believe this is a good timing also for this conference, because many of these provisions actually can be very good added value for the activities of dog population management. Some of the proposals which I'm going to give in my lectures actually will idea of this proposal coming from this new EU legislation. Regarding dog population management, we heard in the last 2 days many things, so I will not repeat what was said concerning the why is important to organize very well dog population management, of course from the citizen safety, also from the animal welfare issue, very good management practices, but I will, in my presentation I said I will speak a little bit more in depth concerning the public health issue of this problem. What is the public health concern of dog population management? Usually we know that it's a problem concerning the spreading of zoonosis among the humans, environmental pollution. I think so I didn't hear in these last 2 days about this issue any lectures, but I think so some, I was informed that this is the first conference. In the future you're planning to develop a new conferences. Maybe some of these fields which I'm going to present in my lectures can be idea which kind of lecturers in this conference to be invited. So probably somebody who is working about the environmental pollution regarding of the stray dog problems, it also can be very interesting contribution of the conference. Of course, public health issues are traffic accidents, by dog attacks, injury by the people, fear of the dogs of their aggressive behavior. So this is the issue which are related with the public health concern of dog population management. But also I would like to stress something which is not really new concept. Something like 10, 15 years ago we're starting to develop from the veterinary profession concept of One Health issue. And I believe that dog population management is very fit with this concept. We should be aware that this concept is really interdisciplinary. Very different disciplines should be involved in this concept. For example, in this dog population management always should go in line with the human institutes concerning the public health. So probably in the future, if you're planning to organize the conferences, some doctors can be invited actually to discuss about the spreading of the different zoonoses as a reason of the stray dog problems. So also their thoughts, their approach maybe can be added value what we would like to develop in order to have a proper dog population management with the real results of that activities. Of course, if we are thinking about the One Health concept, then we should be aware that this concept has a driving forces concerning the communication barriers, economical constraints, and different societal perspectives. So we should think that our dog population management activities to be sell in front of the society through the One Health concept. Of course, not only to sell to the society, to the sell to the police, political person who are driving the schemes of the new policy concerning the dog population management practices, and then if we are discussing with them through the One Health concept, I think so can have some efficient result regarding of that. Also, in the last 2 days, we heard different reasons why monitoring and evaluation of dog population management should be developed, because this is the basis of the development of the strategy. Of course, the economical issue is also part of that. I will not discuss many details about that because we already heard several issues about that. But some things were not stressed maybe deeply in this problem about the stray dog, concerning the different social, cultural, and religious influences concerning the community of stray dogs. I'm coming from Macedonia, and we are living in a society which is a multicultural. We have different religions group, different national group, and their attitudes toward the stray dogs is completely different. So if we are going to see in the many small cities where the people are living in the individual houses with the backyards, actually they don't recognize these dogs as stray dogs. If you're making a surveillance with them, they will say, no, this is our dogs, it's not stray dogs. They're living on the street during the night, they're going in backyard of these communities, and they're getting food from that communities. So if you are discussing from the perspective that this is a stray dog, this is a problem, they will not accept that opinion. So I think so when we are designing the dog population management, of course we know that dog population management should be tailored on the base of the local dynamics and local cultural and social influences. Then we should create all activities regarding from that perspective. Somebody yesterday or today said that this problem will never be solved completely concerning the existence of the dogs on the street. This approach actually is giving you actually answer why this is a continuous process which is not never ending, because we should accept different culture and how we accept the dogs on the streets. Concerning the monitoring and evaluation, we know that we should measure some measurable indicators in order to know how to evaluate it, successfulness of dog population management strategies. And here is example of many different indicators which are already mentioned in the previous lectures about the measure number of the dogs, number of the dog attacks, dog bites, car accident, whatever. And we are considering them as a part of the dog welfare issue. Also, we're discussing about the public attitudes, how the perception of the community are dealing with this problem, which kind of public awareness campaign should be rise up. We discuss about the fostering of the rehoming of the dogs, etc., etc. So we should know that we should try to create some kind of measurable indicators in order to know does this activities has any successfulness or not. Because all the time we are discussing about the emotional attitudes, about the we are part of the community where we are love the dogs, but also we should discuss about the public health issue and how should measure it that. Also, we should try to discuss about the human behavior and how should measuring that. Today we heard that actually very often the humans are problem, not only the dogs concerning that. So also we should discuss about which kind of evaluation, which kind of surveillance we should create in order to understand human behavior, which kind of responsibility do they have, and which kind of activities the people should have it. So if we are going back concerning the public health issue, then we should know that measurable indicators from the public health issue is actually collecting the information concerning the number of the human cases of the different zoonotic diseases, number of traffic accidents, number of dog attacks and dog bites, etc. So this is a measurable indicators. These measurable indicators we already heard yesterday from early lectures about the existing of the ECAM indicators for dog population management. And now in the next several slides, I'm going to share some experience which we have it in our country, and we took it, actually, this indicator is a starting point about the evaluation of our activities in the country. So we take it from the public health perspective, impact 4 concerning the ECAM indicators. The impact 4 is reduce the public health. We know that this impact 4 has a 2 level of indicator, the primary indicator and the secondary indicator. So we were trying to collect the data from our national database, which are existing as a part of the competent authority activities. And then this data, we are trying to evaluate it and making a ratio concerning from the perspective of the secondary source of indicators. The primary indicators is the percentage of the microchip in the country, percentage of sterilized dogs, but we did it in our evaluation on the perspective of the number of the dogs presented per 1,000 population, 1,000 person per population, because we are in the country where we are living with the in the cities with a different number of the citizens. So if we would like to measure actually how this intervention actually has a statistical significances on the society, we were trying to equalize the whole number on the level of 1,000 citizens per city. Also, we did that statistical evaluation from the perspective of the secondary source of indicators like dog bites, dog attacks, etc., etc. Also, we do evaluation of the human cases of leishmaniasis and echinococcus and so on. We published this, actually we presented these findings from on the 5th annual meeting of European College of Animal Welfare Ethics and Law, together with my colleagues Dimitar Trzivski and Dimitar Nakov, but also we were collecting the information from the literature about this actually evaluation of dog population management using measuring indicators on the impact of that problem on the field, yeah, practically evaluating that. Some of the results I'm going to share here with you. Actually, you can see that sorry. This is, I forgot this. This is the slide which I'm explaining this impact 4 of the dog population management. And this is where we published these findings on this conference in Pisa. And then here are the results of that findings. Here you can see actually that we collect all information for the different municipalities in the country, and then we are trying to analyze the data which competent authority have it from the activities of the shelters. You can see about the percentage of the female sterilized dog, percentage of the male sterilized dogs in the shelters and so on. For that reason I asked Tatiana today about the statistical analysis which Zagreb shelter is doing that. Actually, according to our legislation, each shelter should provide competent authority with this data. Problem of what we are having here is that nobody knows about the data. These data are not public. As Tatiana says, municipality never ask about this data, but these data are very useful, not only to evaluate the work of the shelters, but also it's very useful to making a policy strategy concerning the dog population management, especially from the public health perspective. Also, we evaluated this health perspective about the number of the dog bites, percentage actually, of the dog bites, dog attacks, car accident and so on in the different cities in Macedonia per 1,000 citizens, inhabitants in these cities. For example, here it is very interesting result showing that in Ohrid, the number of the dog attacks are the higher than the comparable with other cities in Macedonia. And this is a logical explanation because the Ohrid is the main touristic city in the country, so every year the tourists are coming, they're bringing their dog on the streets, so in the streets there is a new commerce from the dog perspective, so maybe the reason of the so big number of the dog attacks in Ohrid is really reliable. So, as I said, we made a ratio between the different incidents about the dog bites, dog attacks, and car accidents from the different municipalities. Here you can see the results, which are actually the results on the total number, not per the citizens. In our next steps, we are planning to develop this type of ratio on the municipality level, and I will show you our strategy, how we are planning to do that. Concerning the conclusions in this work which we did, here you can see that some kind of statistical significance correlation which are appearing on the base of the evaluation of the total number of the dogs in the country. For example, we find a very logical significant correlation that the size of the population of owned and stray dogs has a positive intervention such as sterilization and castration. That means that in the cities where the number of the dogs, owned and stray dogs are higher, that the number of the intervention from the sterilization and castration is higher. But also, for example, you can find that population of the owned dogs significantly affect the rate of the dog bites, dog attack, and traffic accidents. I'm speaking on the population level of the whole country. So can we have some kind of biological conclusion why this is happening, that the number of the owned dogs has a significantly statistically affect the rate of the dog bites, dog attacks, and traffic accidents in the country? Also, additionally, the population of dogs released after the shelter had a statistically significant influence on the incidence of the dog bites. Is it provocative, this conclusion, that if we are returning the dogs on the streets, that these dogs, actually the number of these dogs actually has a higher incidence of the dog bites of the population? So, of course, if we are making this evaluation on the municipality level, additional clear answer we are going to get about that. So I will not go in detail about this. This is this conclusion which I already explained about that. So, which kind of solution we would like to develop in our country concerning this problem? And we had activities in the last couple of months with the Food and Veterinary Agency in Macedonia. Suddenly, we have some kind of political support what we are going to propose to our community. We already proposed some structure, and I'm going to share this structure with you. Actually, we proposed that on some strategy about this problem, top-down strategy, that we are planning. Actually, we already have preliminary meetings about that. We are established some kind of national committee for dog population control. This national committee, we are saying that this is not still national committee, this is a working group, is established in Food and Veterinary Agency. In this committee, we have a representative from the veterinary chamber, representative from the veterinary faculty. Also, we have a representative from the Ministry of Environmental Protection, Ministry of Local Community, also representative of the Association of the Municipalities, also representative of NGO. We are waiting nomination of the representative of the Public Health Institute. So what is our idea on this? Actually, idea is that we should go on the regional level in Macedonia to discuss this national committee establishing to be established on municipality level. That means a top-down approach. In Macedonia, we have a 6 region. We heard today that in Croatia you call it Županija that, and also you mentioned that in the previous lectures that you have by the law establishing of the working group. But we are now working of our new welfare law. Maybe we can use that experience from Croatia to transfer it in Macedonia, because this system is similar, like you said, in Croatia. That means that in these meetings, the first meeting is scheduled 29th of April in Kavadarci, southeast region of Macedonia, that several municipalities will be present. The mayors are invited, also representative of these ministers, which I mentioned previously. They have also on municipality level, they are representatives, also they are invited there. And then we are going to have 8 different meetings from the beginning of 29th of April up to the mid of June. And then we are going to discuss and we are going to share actually our idea concerning the implementation of these indicators and measuring indicators of the municipality level. Which kind of topics is going to be discussed and which kind of topics we would like to establish on municipality level in order to work with this problem. So here you can see actually the topics which we would like to establish and discuss on the municipality level. First, of course, public health. For that reason, we invited National Public Health Institute as a member. Also, National Public Health Institute has their own offices on municipality level. So their person will be invited on this meeting. Thematic focus concerning the community well-being. It's, as I said previously, this is a One Health approach. For that reason, we are trying to discuss about the community well-being, not only about the dog welfare problems. Also, we are going to discuss about environmental impacts on the municipality level, dog welfare, of course, and human factors, especially human-animal relations. On the basis of this 5 thematic focus for this top-down strategy, we are going to discuss with the mayors and the other representatives from the municipality level these different indicators and different impact which these indicators are actually having on the different, let's say, One Health focus points. This is the, let's say, exercise which we are planning to do. I don't know how we are going to be succeed in that, but I would like to share this experience and to get your opinions about. Maybe you will have added value of what we are discussing about this. For example, we are going to discuss with the people about the percentage of the total number of dog population in municipality. I have experience. For preparing this, I had several meetings with mayors, different mayors in the country. And on the meetings, I asked them directly, how many citizens your municipality has? And they immediately answered me that question. But when I asked him, how many dogs do you have in your municipality? He said, I have no idea. I never thought that I need to know that number. So I believe that if we succeed in that, then we should explain to the municipality mayors that there is a database in Macedonia of the microchip dogs, which is existing since 2018. This database is completely closed. It's only existing in the software at the competent authority level. With these activities, I would like to actually open that database from the perspective of the municipality. At the meeting, veterinarians will be invited as well. These activities will be pressure to the veterinarians also. Why? Because we are, I don't know, in Bosnia is that happening. We have situation in Macedonia that veterinarians are giving the services to the owners of the dog which are not microchipped. I didn't want to report that situation that this dog is not microchipped. If we open this database in front of the mayors, because they don't know that it's existing, I believe that it will be a pressure to the veterinarians as well, but also pressure to the owners of the dogs. So for that reason, we are trying to introduce it. That I had several presentations in Macedonia about this issue, and then it is a very interesting reaction of the people who are not part of the veterinary profession that this is existing. For example, I asked them, okay, you are going to have information about how many dogs you have in your municipality. Do you have information how many dogs are not sterilized in your municipality? I ask now this political structure in Macedonia, they already have a contract with the government. They are going to open the cemeteries in the different cities in Macedonia. And I ask them, okay, do you have any figures? How many dogs do you have in your municipality in order to open the cemetery? Which kind of activities, which kind of budget should be allocated in order to have that activity? So this approach actually will help to the dog population management from the perspective of One Health, that this will be opening of the whole problem in front of the policymakers, and then maybe their approach will be positive to help us in the developing of this strategy. Also, I would like to share additional information with you that some of the activities we are trying to develop together with the Messerli Institute from the Messerli Institute from Vienna, because we would like to introduce an additional animal health issue about that. Here you can see actually this different impact and different indicators which we allocated per the impact. And this impact differences, as I said, is from the part of the One Health perspective. You can see the indicators are reliable concerning the dog population management, community well-being, public health, dog welfare, and environmental impacts. Some of them they are already existing in our database, and these actually just should be open in order to be evaluated and discussed in front of the municipality layers. For example, in our faculty, we have a PhD program concerning the antimicrobial resistance. Now, recently, the one PhD graduates will ending her lectures with the existing of the antimicrobial resistance in the stray dog community, which is, I think, so very interesting result from that evaluation. So this structure, which I'm trying to share with you, is here. Then you can see that we have a competent authority and veterinary services and the different municipality level activities which we are planning to do, from the existence of the presence of veterinarians, local authorities, NGOs. Of course, the media should be also part of these activities. We already have some interview arranged on that meeting, which we are going to have on 29th of April. And of course, education and schools to be part of this structure. Here actually is the idea that continuation of the whole process actually should be established, and the main stakeholders are citizens in the municipalities with the different data which should be collected. So, instead of conclusion, I divided this top-down approach in the four different areas of activity. The first area of activity is coordinated assistance at the municipality level, monitor and evaluation of the indicators at the second level, animal health plans, animal health welfare visits, third one, and training area is dissemination, fourth one. About the first one, I already said that we established this working group on national level. Now we are going to do that on the municipality level. What is important to succeed in this exercise in the next 2 months is actually to have appointed a contact person on municipality level who is going to actually intervene with the other organization in this network in order to share the data and to making evaluation and assessment of these data. So somehow we would like to establish this national task force for collaboration on municipality and regional level. Concerning the monitor evaluation of dog population indicators, I said that different indicators we are going to follow from the perspective of the number of dogs and using of the database which is already existing on the municipality level and to evaluate this data. What is important of this system? Dynamics of the system. Because we said that this data are not fixed one. For example, the total number of the dogs on municipality level is changing during the time. So if we establish this system, then this changing will be followed by these working groups on municipality level. The third one, for the veterinary perspective, is most important one. Yesterday I asked one question, the lady from the European Commission, regarding the animal welfare visits. I already put it in my presentation, this animal welfare visits, because I was informed about what kind of new provision of directives is planned to be done. And I asked her who is going to provide these animal welfare visits. She said the private veterinary clinics. So if we have that system in the country established, these private veterinary clinics should be one of the more important actually chain of the whole system of the collecting the data. I said about the percentage of the non-sterilized dogs on the municipality level, from where this information should become. From the veterinary doctors who has actually their clients who actually asking the services of them. Also, we heard today about the behavior modification expertise that should be developed on the veterinary clinic level in order to save the citizens concerning the dog bites, dog attacks, etc., etc. So this system also can be part of the activities of the veterinarians who are actually the main chain of the whole system. Then training and dissemination activities, education, schools, it's already says many times about in these 2 days concerning the activities from that perspective. So I hope this will be also part of our plans. At the end, I would like to stress that there is a lot of activities which are already developed by the veterinarians from the perspective of the behavioral modification, about the responsibility ownership and healthy breeding of dogs. So you can see the several public documents which are developed by the Federation of Veterinarians of Europe, which are actually very useful for veterinarians on the national level to be translated, distributed among the veterinarians and the citizens, and to establish this system on national level. Also, there is a document concerning the animal abuse and also concerning the different practices for the breeding of dogs developed by the Federation of Veterinarians of Europe. At the end, the benefits for the veterinary profession is very strong regarding the actively participated in this dog population management problem concerning the establishing of this animal welfare standard, demonstration of the high animal welfare standards, evaluation, and improving for the dogs health plan. I didn't mention that. This is very important from the perspective of the own dog, but also from the perspective of the shelters, that this health plan should be part of that system. And of course, a recommendation of the legislation is the final goal of these activities. Thank you very much for your attention.